Very good morning. Hi there. This is Gilbert here. TRAXXfm Momentum Health on Traxx. My producer Achu and we have Zam in the studios. Now, just to let you know, if you happen to be on our social media platform on Facebook, it's TRAXXfm Official, and then on TikTok, well, it is TRAXXfm Official. If you happen to be on Facebook, check us out at TRAXXfm. All that much more right here on the show. Do talk to us if you have any questions. Probably you'd like to ask the good doctor. You could do so. Today's topic, and we'll be talking about HIV/AIDS, breaking the stigma through knowledge. Knowledge is very important, and we'll be talking to our guest in the studios, Dr. Anjana Kukreja, who is the clinical specialist in infectious disease, Department of Medicine, UMMC. And just to let you know that December happens to be HIV and AIDS Awareness Month. It was celebrated on the 1st of December. And it is a time to raise awareness and reflect on the impact that this epidemic has had on our community and to the world. So talking to our doctor, getting more details, having a little knowledge about HIV and AIDS. And as Dr. Anjana, who will be giving us all the answers that you need. So remember, on our social media platform, on Facebook and on TikTok, it is TRAXXfm Official. And if you happen to be on Facebook, it is TRAXXfm. Right here on the show, Health on Traxx. Very good morning to you, Doctor. Hi, how are you?
Thank you, Gilbert. Thank you for having me.
Welcome to the show. It is Health on Traxx. Doctor, it's your first time here in RTM, but we were having this casual chat, and it says that doctor said that she used to grow up listening to us.
Yeah,
Radio 4.
when it was Radio 4 and then when it was rebranded to Traxx. So it's a very surreal feeling. Thank you so much for having me.
So nice to have one of our listeners who has been so faithful to us all this time. It's nice to have you here. First time in RTM.
Yeah, first time. It's a very nice, well, I like to say campus because I come from but it's really beautiful. Yeah.
Welcome to RTM. Welcome to TRAXXfm. Doctor, just before we get into our topic, HIV/AIDS, breaking the stigma through knowledge, Doctor, could you just tell us a little bit about yourself?
Sure. Hi, my name is Anjana. I am an infectious diseases physician. I've been working in UMMC now for the last 10 years, but in ID specifically for the last 4 years now.
Okay.
Yeah. My passion is actually women living with HIV, but yes, I love to talk about anything to do with HIV. Yeah.
All right, Doc. Doctor, we're going to jump into our topic for today on Health on Traxx Momentum. Doctor, HIV, now this and AIDS, of course, some of us basically get it confused. So, Doctor, could you just break it down for us? What is HIV and how is it different from AIDS?
Sure. So, HIV is an abbreviation or it's short for human immunodeficiency virus.
Okay.
So, essentially, it's a virus that attacks our immune system. And our immune system is really very beautifully crafted. But a key component of our immune system is something called the CD4 cells. And what HIV does is it destroys our CD4 cells. And so that makes us more vulnerable to infections and we can get really, really sick.
Okay.
AIDS, on the other hand, is acquired immunodeficiency syndrome. So it's actually the advanced stage of an untreated HIV infection.
Right.
So the immune system gets really severely weakened. But if someone is diagnosed early and started on treatment early, they don't progress to AIDS at all. So that's the good news. Yeah.
Okay, so that means we can tackle the problem of HIV.
Yes.
Once somebody has contracted HIV.
Yeah. So the moment they've been infected, if they are screened early, we can get them on treatment very quickly, and they live long, healthy lives, just like someone without the infection.
Okay.
Yeah.
All right. So there you go. But that doesn't mean they do not have HIV.
No, that's not what it means. They do still have HIV
Right.
if they've had the infection. It's just that the virus is very well controlled.
Okay.
So the virus is put to sleep. So it's like someone with diabetes. They are on medications for a very, very long time, almost their whole lives.
Okay.
But the diabetes is under control. So it's the
Okay.
same thing. It's the same concept, really.
So there you go. That was very simplified, or it was explained very simplifiedly. Doctor, how is HIV transmitted now? This sometimes many of us are callous. Many of us do not even know or not aware of situations like this. So it's nice to have an explanation on this, Doctor. How is HIV transmitted, and what are some common misconceptions about it?
Okay, yeah. So it's actually transmitted through specific body fluids like blood, semen, vaginal fluid. It's not transmitted from like sharing food or using the same bathroom or hugging someone with HIV.
Right.
So it's very specifically through like vaginal fluid or seminal fluid, and blood, of course. There are also cases of mother-to-child transmission, but thankfully Malaysia is one of the few countries that has eliminated mother-to-child transmission, which is a really good feat. And breastfeeding is also one of the ways of transmission.
Okay.
Yeah.
So that's that one there. I didn't know that.
Yeah.
There, Doctor. Okay. So there you go. To clear all the doubts that you have and to give you a little knowledge about how HIV has been transmitted. Doctor, what does treatment for HIV involve, and how does it help someone to have a healthy life? I mean, how does this work?
Okay, so actually treatment for HIV has been really simplified. It's one pill a day. That's it. It's just one pill a day.
Okay.
Of course, there are other regimens that might involve more pills, but in general, it's just one pill a day. It's known as antiretroviral therapy, or ART.
All right.
And what it does is, essentially, it puts the virus to sleep. So the virus goes to an undetectable level, so your immune system remains strong. You live a long, healthy life. But more importantly, when your viral load is undetectable,
Right.
you're untransmittable. So there's this thing called U equals U that you might have seen people advertising on social media and things like that.
Right.
It just means undetectable, it's untransmittable. So they cannot transmit the disease to someone else.
Because it's like it's been put to sleep.
It's been
or
put to
it's,
sleep.
Okay.
Yeah.
All right.
Yeah.
That's and the explanation by Dr. Anjana and how transmission happens and of course the differences between HIV and AIDS. We are talking to Dr. Anjana here, clinical specialist in infectious disease, Department of Medicine, UMMC, and today's topic with regards to World AIDS Day that was celebrated on the 1st of December. And our topic today on Health on Traxx, that's Momentum, HIV, AIDS, breaking the stigma through knowledge. Knowledge, the most important thing to understand HIV and AIDS. And as Doctor just gave us a little introduction to the difference of HIV, AIDS, how it's transmitted, and how treatment happens. So when we come back, we'll be talking to Dr. Anjana and talking a little bit more elaborated on the topic, which is testing for HIV, how important it is, steps that people can take to protect themselves from getting HIV, all that much more right here on the show. So do stay tuned. This is TRAXXfm Momentum on a Monday. right, very good morning. Welcome back to the show. It's Gilbert here on TRAXXfm's Momentum. Health on Traxx. Monday, different topics, different days, from Mondays till Thursdays. And today it is Health on Traxx with my producers in the studio. We have Achu, Zam. Happen to be on a social media platform? Well, you can talk to us. That's on Facebook and also other media platforms such as YouTube and also on TikTok. Facebook, it is TRAXXfm, and on the other two platforms, which is Instagram, not forgetting for YouTube, and also on TikTok, it is TRAXXfm official. So get on board, talk to us, get to know the topic that we are discussing with our guests in the studios. We're talking to Dr. Anjana, who is the clinical specialist in infectious disease department of medicine, UMMC. And as you know, that HIV/AIDS, well, the awareness month celebrated World AIDS Day on the 1st of December. And what we're doing right here on Momentum is giving you a little bit knowledge on HIV/AIDS, breaking the stigma through knowledge on HIV and AIDS. And as the doctor did explain to us much earlier on, the differences between HIV and AIDS, how it's transmitted, and treatment for HIV, what does it involve, and getting into more of our topic or questions that we have for Dr. Anjana here is, Doctor, could you just tell us, why is testing for HIV crucial? Why is it important?
Well, I think because, knowing your HIV status is really the first step in taking control of your health.
Right.
Like if you are diagnosed early, you are started on treatment early, it keeps the virus under control and it can prevent complications.
Okay.
But on the other hand, if you test negative,
Right.
And you feel that you are at risk of acquiring the infection, then it opens doors to prevention. And, there are a lot of preventive measures which we'll talk about later, like PrEP, and that can really prevent you from ever getting HIV.
Okay.
So I think, testing is really important because whether you're positive or negative, something good will come out of it.
Okay.
And in Malaysia now, it's quite easy for testing. I'm just going to share that we have something called the Test Now platform.
Okay.
You can just Google it. It's a website which was done with collaboration Ministry of Health, Malaysian AIDS Foundation, Malaysian AIDS Council. And what it does is it provides HIV self-testing anonymously.
Right.
So you can just go on it. You can do a risk assessment questionnaire. It's all anonymous.
Okay.
And then if you're at risk, they will suggest for you to get a self-testing kit. And the self-testing kit can be posted to you wherever you want.
Nice.
Yeah. And then you do with steps on how to do it.
Okay.
And then you can share back the results if you wish to. And if it's
Right.
positive, they can advise you on what to do next.
Okay, so
Yeah.
sometimes I think that people probably they might have this, they might just feel uncomfortable,
Yeah.
probably embarrassed, or that prevents them from even seeing a doctor.
Correct.
So now things are
exactly.
made so much more
So
easier.
much easier. It's accessible. It's confidential.
Yeah, that's
Yeah.
the word. That's the
Yeah,
word.
so-
Confidential.
yeah.
Doctor, could you just tell us one more time what is the website that it could?
Test Now. TEST now.
Okay.
Test Now.
Okay, so
Yeah.
it is Test Now. Get onto the webpage,
Yeah.
Test Now, and follow
Yeah.
the instructions.
Just
All-
follow
yeah,
the
yeah.
instructions. Yeah.
Nice. So there you go. Nothing is for you to reveal. Everything
Yeah.
is personalized.
Yeah.
All right. Doctor, what steps can people or an individual take to protect themselves from contracting or probably getting HIV?
Okay. So first is if someone is at risk for getting HIV, there are many things that you can do. The first is, of course, consistent condom use.
Okay.
So that prevents not only HIV but also prevents sexually transmitted infections as well.
Yes.
But there's something called PrEP, which is pre-exposure prophylaxis. Essentially, it's just a pill a day that prevents you from getting HIV. It reduces your risk by up to 19, like it protects you by like 99%. And PrEP is available. I think a lot of people don't know this, but over 30 clinic kesehatans around the country, including Sabah and Sarawak, have PrEP.
Okay.
Yeah.
So it's a pill.
It's a pill. It's one pill a day and it prevents you from getting HIV. But not other sexually transmitted infections, just HIV. So that's
Okay.
where the consistent condom use is also really important.
Right.
Yeah.
Okay, so that's
Yeah.
that's more important.
Yeah.
And wow, can you imagine how technology has moved, Doctor? That's
Yeah.
amazing.
Yeah.
Now with PrEP and things can be avoided.
Yeah. Things can be totally avoided.
Okay.
Yeah.
And Doctor here, can you explain what is the 959595 targets? What do they mean, and Why are they so important? I haven't heard of this, doctor.
Okay. So, UNAIDS have come up with this. It's 95, 95, 95.
Okay.
So, their target is that by 2030, 95% of people are aware of their status, whether
Okay.
they are positive or not.
Okay.
The second 95 is those who are positive,
Uh-huh.
95% of them are on treatment.
Okay.
And the third 95 is those who are on treatment, 95% of them are virally suppressed, which means their virus is sleeping, their viral load is undetectable.
Okay.
Now, based on the Global AIDS Monitoring Report, which was published this year, which reflects last year's data, Malaysia is at 84, 68, and 89.
Okay.
So we're not close to the 95, 95, 95. We're at 84% of
okay.
people aware of their
Aware of it?
status.
Yeah.
68% of them are on treatment,
Treatment.
and 89% of them are virally suppressed on treatment.
Okay.
So we are really struggling with the first two, which means getting people to check their status and then linking them to care.
Because now you have something which is so conveniently done. You can do it on the
Yeah.
internet, which is test now.
Yeah.
And that's where they get the awareness.
Yeah.
I mean, they know that it exists. Get on it, do the treatment if
Yeah.
if you're tested positive.
Yeah,
that's
so
simple.
Test Now was designed to address the first 95 and quickly do the second 95, like quickly link you into care.
Right.
Yeah, but there's a lot more efforts that will be taking place over the next year or so, and it has been this year as well, to emphasize on the second 95, which is really linking people to care.
Right.
Because sometimes people know their status and then they're just too afraid to come in.
So the treatment part is another issue
Yeah.
here. Okay, so
Yeah.
that's where we have to have the numbers up to 95.
Yes.
So it is 95 awareness, 95% of awareness,
Yeah.
95%
on treatment.
on treatment, and 95%, which is the target to
suppress their viral load.
So there you
Because
go.
then this way we will be able to actually end the AIDS epidemic.
Right.
Yeah.
Simple as that.
Yeah, simple as
Okay,
that.
and everything is personalized.
Yes.
Test Now, that's the website that you should be checking. And if you're talking about prevention, that's PrEP.
PrEP.
Okay, there you go.
Yeah.
Very well explained by Dr. Anjana right here in the studio with us. She's the clinical specialist in infectious diseases, Department of Medicine, UMMC. And Dr. Anjana, thank you so much. We've got two more questions that we'll be asking our doctor, but taking a very short song break. We'll be back. And if you happen to be on our social media platform, that's on Facebook, it is TRAXXfm, TikTok, and also on YouTube. Not forgetting for Instagram, it is TRAXXfm Official. Back in a bit. Stay tuned. This is TRAXXfm. Welcome back to the show. Hi there, this is Gilbert here, TRAXXfm Momentum on a Monday, and today's edition, the 16th of December. My goodness, 16th of December already, Doctor. Can you believe that we are already going to get into Christmas and then into New Year?
Yeah, the year has just flown by. I can't believe it.
Super fast. Now, when things happen super fast, everything else around us happens super fast. And yes, today's topic, HIV/AIDS, breaking the stigma through knowledge. Very important having the knowledge. And just to let you know that December is HIV/AIDS Awareness Month, time to raise awareness and reflect on the impact that this epidemic has had on the community and onto the world. Celebrated World AIDS Day on the 1st of December. Talking to our guests in the studios and how do we differentiate HIV? How do we differentiate AIDS? And what's really, really interesting is testing for HIV. That's very important, and they have something which is personalized. The website that's personalized. All you have to do is just get onto the webpage, test now, and follow the proceedings, follow the instructions, and it gives you a little bit more updates on how you get yourself tested for HIV personally. Okay, so that's something which is amazing with technology these days. And Doctor, getting back to more of our questions here, Dr. Anjana, stigma is such a big issue now. Why do you think that how can we overcome the stigma of HIV, getting tested, having the treatment done, and suppressing
Yeah, actually stigma is really a huge problem even in this day and age. And I think it stems from a lot of outdated beliefs and judgment of people. And I think education is really key to break stigma, understanding that HIV is manageable now, people on treatment don't transmit the virus. I think just having kindness and compassion and treating everybody with a little bit of dignity will go a long way in creating a supportive society. That's one of my biggest hopes really, that we just be a little kinder to one another, because everybody's going through some sort of illness, whether it's HIV or diabetes or struggles with mental health. There's so many things, and it just goes a long way when people understand one another. Yeah.
All right, so be kind and yes, spread the knowledge. That's something which I think most of us need to do. Doctor, one last question here before we end our interview of the day. Health on Traxx and HIV/AIDS, breaking the stigma through knowledge. Doctor, any message that you would like to share to our public on World AIDS Day?
Sure, actually I'd just like to encourage all Malaysians to really be a bit more empowered about your sexual health. So take care of yourself. If you think that you're at risk, get yourself tested, get yourself on treatment, get yourself on PrEP, or just talk to us. Come to see us in case you can come to us in the ID clinic, and just take control of yourself. That's really important.
Since we have at least about a little bit more time, this question here is not really actually. Doctor, what happens if like somebody who are probably who is healthy, all right, and just for the sake of testing, could we just do that?
You could. I mean, it's probably be negative, but
right.
Yeah. So understanding your risk is really important.
Okay.
So those who have multiple sexual partners, men and sex with men, those are the key populations that we really want them to get tested.
Right, there you go. If you're in that lifestyle,
Yes.
okay, so well, there you go. The website, which is Test Now.
Yeah, especially now, young people have a lot of apps, so it's very easy to socially connect with one another. And so, it's really important because you don't know who you're meeting, where you're meeting, who those people have met as well.
Right.
Yeah, so it's really important to take control of your own mental health.
There you go. Be awareness. That's the most important. That's why we have today's topic. Thank you so much, Doctor. Doctor, it's so nice to have you here.
Thank you so much.
Who grew up with us, Radio 4.
Yeah.
Thank you once again. Health on Traxx, HIV/AIDS, breaking the stigma through knowledge. Dr. Anjana Kukreja, who is the clinical specialist in infectious diseases, Department of Medicine, UMMC. And while as we celebrated World AIDS Day, which was on the 1st of December, this particular interview that we have with Dr. Anjana is creating awareness on HIV and AIDS. Thank you so much for taking time off and being here with us, Doctor.
Thank you so much for having me.
You're welcome. Thank you to my producer, Achu Zam. Thank you so much. And for those of you who just happen to be on our social media platform, thank you for joining us on Health and Traxx. Once again, happy holidays and for the upcoming Christmas celebrations, all season greetings.